Hello, my name's Carol Smith from an organisation called North East Counselling Services. We are a counselling agency who employs around 50 counsellors to provide tailored service for anyone who needs to access counselling quickly. At present, we're delivering counselling by Zoom or telephone, but when times get better, we'll be delivering it by face-to-face again in the northeast of England. What I wanted to do is to talk to you about how do you know if your staff are having problems. And when I'm talking about problems, I'm talking about mental health problems. This is something that lots of managers have brought up with me when I've been out talking to customers. And the first thing to think about is, what is mental health? It's a term that's bandied about quite a lot, and I think sometimes we forget to think about what it actually means. And mental health is generally used as a shorthand for poor mental health, but actually we've all got mental health, and our mental health is on a spectrum. So some days we're towards the right hand side of the spectrum with positive mental health, and other days we're up at the red end of the spectrum on the left with poor mental health, where we might need professional support. But most of the time we're moving between the four different rungs of the ladder, if you like. And really what we want to do is watch out for the signs that somebody's mental health is moving towards the left. And hopefully I'll be able to give you some hints and tips about things to watch out for and things to stop it happening and move, to help people to stay down at the green end of the spectrum and not move up to the red. And then we think about, what is the impact of mental health at work? Well, it's stressful to be a manager of staff without the fact that they bring in mental health problems or they're experiencing mental health problems, and you might not know how to best help them. And we've all heard this figure, haven't we? 1 in 4 people experience some form of mental health problem each year. But I don't know how true that is. I think we probably all experience some form of mental health problem at one time or another, and we move between the spectrum, as I said. But things to watch out for are people who could normally multitask. 48% of people who are experiencing mental health problems are finding it hard to multitask. They find it difficult to concentrate, and they might take longer to do tasks than they normally would. Another thing which has a huge impact on managers is that 37% of people with mental health problems are likely to get into conflict with colleagues, and 48% are less patient with customers. And if you've got staff members who are customer facing or working in small teams, this can have a huge impact on the rest of the team and the rest of the people's mental health, and an impact on everything they do. And the figures are huge. Mental ill health costs employers about £30 billion a year. And that's not just people taking time off work, it's people coming into work when they're not really feeling great and being less effective than they would. It can be classed as a disability, so lots of people shy away from talking about mental health problems because they're worried that they'll overstep some boundary. And actually, it's better to talk about problems than not talk about it, than to treat it as taboo. There's been some research done by the Chartered Institute of Personnel and Development, which said that staff are more likely to stay in work or take less time off with mental health problems if they feel they've been supported. And it's not a sign of weakness. Sometimes we look at people who are experiencing mental health problems and think, well, we can't give them that bit of work to do. It might send them over the edge. But actually, it's worthwhile talking to people about what they can cope with and what they can't cope with. And don't view it as a sign of weakness or inability to cope. It's the impact of something that's happening to their brain at this moment in time and may not be long term. When you became managers, you all got the handbook, didn't you? Everybody does. No, of course they don't. We become managers generally because we've got a good go-getting attitude, we're really keen to do things, and we're good at our job. And most people get thrown into the role of management without even having any people management training or explanations or anything like that. And it can be a huge drain on time and it might be something that you dread doing, or it might be something that you love, but it's recognizing how comfortable you feel about these things. A big part of how you might deal with mental health is to do with the culture of the organisation. If mental health is taboo, people will be ringing in sick with all sorts of problems apart from the mental health. There'll be stomach upset, or got diarrhea, that kind of thing. And people won't want to talk about it if it's the mental health. Do you treat mental health physically to physical health? If your policies say you ring somebody who's on long-term sick every week to see how they're doing, would you do that if mental health was the problem? Some organisations think they can't possibly speak to somebody if they've got mental health problems, but it actually makes people feel more included and more supported, and it might bring people back to work earlier. So think about if you would talk about something with somebody who had a physical health problem, why wouldn't you talk to them about it if it was a mental health problem? Do you have specific policies in place? Do your policies mention mental health? Do they mention things like having time off to go to the GP, maybe having a day if they're feeling stressed or something like that? And the other thing to consider is, what are your back to work interviews like? I did a presentation to a group of managers where there were two distinctive sets of managers. One were new managers who didn't really have much experience, and the other half were a set of managers who were fairly long in the tooth and had been doing it a long time. And one of the new managers said to me, "Oh, I hate doing back to work interviews, it's awful. It's, you know, you've got a long list of questions you've got to ask and it feels intrusive." And one of the more experienced managers said, "But you don't do it like that. You do it, you kind of weave it into a narrative and you make sure you get all the answers you need, but you don't have to just sit and go through a list of questions." And I think sometimes we forget that we've got to make these processes as friendly and as human as possible. And so if your back to work processes are just a tick list, how's that going to feel to somebody who's experiencing mental health problems? And what are they going to say? So have a think about the culture of the organisation and your part in that. Are the departments in different areas very different? You know, might you walk through one area and hear somebody saying, "Oh God, such and such has gone off with mental health problems. I don't know what they've got to be worried about." And how would that feel if you were experiencing problems? Does it come from the top down? You know, are senior managers really not seen to be acknowledging mental health? And have just a big think about what is the impact on your organisation and to people who are working in it. The next thing to consider if you're a manager dealing with somebody with mental health problems is, how do you feel about mental health? Because we've all got different views, and our own views are perfectly valid because they're based on our own experience. So how you feel about mental health is important to acknowledge. Do you feel comfortable talking about it? Have you had experience of it? Do you just assume that everybody's mental health problems are the same? When I trained as a counsellor, we were taught to explore our prejudices, and prejudice is a really strong word, but it just means be aware of your own opinions about things. Because if you have an opinion that people with mental health problems are weak and pathetic, then if somebody came to talk to you, you would portray that to them and they wouldn't feel comfortable. And the more you recognise you have that view, the more that you can put it to the back of your mind and not let it influence how you talk to somebody about their problems. And it's important to recognise those things and make sure you know where you're coming from and have a look at what message you're giving across to people. And, you know, again, we go back to the CIPD figures. If people feel supported, they're more likely to come back into work earlier or not take time off at all. So think about, what is your view about mental health and how would somebody experiencing problems feel coming to you to talk about it? Then, you know, Keep thinking about what are the signs. Well, I'm a firm believer in making sure we spot things as soon as possible, because what tends to happen is people who are experiencing mental health problems, their behaviour or their mood changes before they even realise there's a problem. And a number of managers I've spoken to have said, oh, I spoke to such and such, and they said, oh, there was no problem. And actually, when I spoke to them again, after I'd pointed out some of the changes that were happening, they realised that they did have a problem, and it helped them to seek help. So watch out for small changes in people, their behaviour and their mood. If they're suddenly Mr. Grumpy when they're always Mr. Happy, have a chat. Or they're always really angry, just say, I've noticed this is happening, what's going on? Does the standard of their work, has it dropped? Those people who you love because you can give them things to do and they always beat the deadlines and you don't have to chase them, if their work starts to drop, it's very noticeable. So again, don't come at it from a point of view of you wanting to discipline somebody. Come at it from a point of view of curiosity, asking what is going on, pointing out if people appear tired, anxious, or withdrawn. Don't just letting it go. Have their coping mechanisms changed? Are they comfort eating? Are they smoking more? Are they drinking more? And then think about their absence rate. Have they increased absence, or are they turning up to work late? Think about all of those things and watch for small signs. And then just have a little chat with them. Make a note of the observations you've had. Try and keep calm through it all. Just arrange an informal meeting, maybe over a cup of coffee if you can, or somewhere that's not a formal meeting, and just explain to them your concerns and say you're coming from a place of, you think that you've noticed this difference and you're really concerned about them, you're worried about them, and then listen to what they say. Don't just make assumptions or jump to conclusions. Just think about what they're telling you and think about what you can do. Make sure you're actively listening. We'll talk about that later. And don't come at it from a point of view of, oh, you must do this, you must do that. Have a think about what they're telling you. Think about how you react to things. We all have a tendency to approach things in either the rational mind or the emotional mind. I'm a rational minded person, and I'm more likely to be giving people the facts and the research and what they should do and things like that. And an emotionally minded person will kind of use emotions. Oh my God, that's terrible. That's really awful. And actually those two things might make the person you're talking to feel really uncomfortable. If you approach things with a rational mind, you might actually appear uncaring. You might appear not bothered about what the underlying issues are. You're just coming at it from a list of facts. And if you come at it from an emotional point of view, you might make that person feel unsafe because they're talking to you, and then what are you doing with that information? You're throwing it up in the air and reacting in an emotional way. And what we need to try to do as managers is to try and just use that wise mind and get the balance between rational and emotional. Show your empathy, but also, don't just react quickly. Think about things. Get people to talk a bit more. If you're not sure about something, ask them to explain. And that's a much more safe place for people to talk to you about their mental health problems from. One of the things we all have in common as human beings is this unconscious kind of three-pronged person inside of us. We've all got an adult mode. We've all got a parent mode, either critical or nurturing. And we've all got a child, either petulant or compliant. Now, if you're talking to somebody, we flip between those different modes all the time, and we've all got them. And how you react as a person can then make somebody else react in a different way. These are unconscious processes. We don't realize we're doing them. And if you can become conscious of how you're acting, then you can take control of situations and stop people acting as a child. So if we're having an important discussion, it's really key to stay in adult to adult mode. But sometimes you might come across as a parent, either critical or nurturing. And that can then flip the other person into a child mode. They might become petulant, they might become compliant, they may say to you, oh yeah, yeah, whatever, it doesn't matter. Or they may lash out at you and hit back. And if they get into that mode, the thing that you need to do, which is most effective, is to move things back up to the adult. You know, say, I'm not having a go at you, I'm not criticizing you, I just want to understand what's going on. Because if you let their petulant or compliant child get to you, then you're more likely to flip into petulant child or compliant child, and you just won't get anywhere. So have a think about the state you're in, and if that conversation goes downhill into an argument or I don't know, somebody storming off, think about what your part was in that and how you can keep coming back to the adult mode, because it is a much more effective way of communicating. Then if you think about communication, how do you communicate with somebody? 93% of all communication that we do is non-verbal. So that's not the words. Only 7% of what we say comes from the words. And if you're talking to somebody who's not feeling great, or you've got this kind of attitude of, well, why didn't you do that? That will come across, and people will pick up on that non-verbal communication. So think about what are you saying to somebody? Are you looking around? Are you doing your emails? Are you tapping your feet because you want them to be a bit quicker? Think about the impression that you're giving them, what your body language and your facial expressions and your tone of voice is saying. Because to get somebody talking is really important, and to keep the communication is really important. And you can just shut it down immediately by, you know, making your communication ineffective. Use active listening skills. You know, maintain eye contact with somebody. Don't mean staring at them, but maintain eye contact. Show them that you're really listening. Use positive body gestures, nod, you know, move your hands, that kind of thing. Show them that you're listening by either using facial expressions or asking them to expand on things, and, you know, keep positive, open body language. Don't look at your phone or your watch or anything like that. And if you do have a meeting afterwards, just say, you know, look, I've got to go and sort something out, and go and sort out the distraction and come back. And then if you give feedback to people, you're actually telling them what you think you've heard, and then they can correct that or not if you've got it wrong, because sometimes it's hard to discuss these things. And just make sure that your communication skills are as honed as possible, and active listening skills can be developed. The more you do it, the better you get. Have they got automatic negative thoughts? We all know people who catastrophize and get into situations where they're dead in the gutter before something's even happened. Watch out for people with those automatic negative thoughts, because they can spiral down into OCD or panic attacks or things like that. If people are really experiencing problems because of their automatic negative thoughts, encourage them to go and get some support. Cognitive behavioural therapy is a really good tool to stop these automatic negative thoughts, and you'll be able to spot it, because everything they say will be a reaction to the thoughts in their head, and they're letting things spiral out of control. When you're talking to somebody, are you going round in circles? Are you saying the same things over and over again and not getting anywhere? You know, the situation we get into, sometimes we just say the same thing. You say, you always do that. No, I don't. Yes, you do. No, I don't. Don't be afraid to take control in this situation. You can't change that person, but what you can do is change the way they react to you. So if they say, you always do that, and you go, no, I don't. Yes, you do. When they say that to you, you could say something like, well, when do I do it? Can you just tell me when I did it so that I recognize what I'm doing? Now they can't just say, yes, you do. They've got to change the way they respond to you, and that changes the whole direction and dynamic of the conversation, because now you get down into the nitty-gritty. And watch out for these circular discussions, because they won't really get you anywhere, and you'll have a meeting with somebody in a discussion and you'll think, that really didn't go anywhere. Maybe it's because you're going around in circles. Some of the things that we say from a place of caring about somebody, but really when the words have come out of your mouth, oh my God, they're really not helpful. And it's important to kind of put your brain in gear before your mouth works in this situation. If you've got somebody who's sitting in front of you and telling you what's going on for them, there's a few phrases really that you shouldn't really say. One is that it? You might be thinking, oh, well, that's not really big, we can sort that out. But to the person you're talking to, that's a huge problem for them. And you've said, is that it? Well, that's not really helpful, is it? Don't say, oh, I know exactly how you feel, because how can you possibly? You don't know how somebody's feeling about a certain situation. You might have exactly the same situation you're facing, but you both see it in a different way, and you both are experiencing it in a different way. And you can say to somebody, oh, I understand that might be hard for you. Tell me how it's making you feel. But don't tell them you know how they feel, because you can't possibly. And these kind of phrases will just shut people down. And what we want to do is get them talking to us. Try not to play kind of, oh, I've got a bigger disaster than you, top trumps. We had one person who came into work and said that a friend had taken her own life. And a lady said to her, oh, I know how you feel, my dog's just died. You can't compare one person's trauma with another. So it's best just to say, oh God, that must be difficult, or, oh wow, how is that making you feel, rather than trying to tell them that they've had a tough time because you've had one as well, because sometimes it comes across as you're saying, oh well, my experience was much worse. Don't give people advice. Don't tell people what to do, and this, oh, if I was you, I would do X, Y, and Z. Well, you're not, and you don't know the full situation. And if you give people advice and it goes wrong, they're not going to be very happy with you. So try not to tell them what to do, and try not to put kind of ideas into their head. I quickly learned when I was counselling people that if I said, have you tried X, Y, and Z? They'd come back the next week and say, oh, I tried X, Y, and Z and it didn't work. And I did what you told us. And you think, no, I didn't tell you to do anything. So a good way to get around that is to say, what have you tried? And what else do you think you could try? And then you're not putting any words into people's mouths at all. And so think about what you're saying, and some of those stock phrases that we come out with because we really want to help people, sometimes they aren't useful. And if you notice something you've said that's made somebody close down, acknowledge that mistake. Just say, oh, I don't know why I said that. That's absolutely mad of me. And then, get back on track and make sure that person's talking. Sometimes we become fixers. We want to fix everything. And as a manager, it's a lovely feeling, isn't it, when somebody says to you, oh, you really helped, you were really fantastic in that situation. But actually, we've got to define our boundaries. And it's where your responsibility stops and the other person's begins. And if you're a fixer, you want to solve everybody's problems because that makes you feel good. But actually, as a manager, you can't do that. People have to take the consequences of their own actions, and you can't bring everybody home to tea with you. So think about your boundaries and watch out that you're not getting into trouble because you're overstepping the boundary. Maybe you're giving out your personal number and telling people to ring you anytime, or whatever it is. Being aware of your boundaries as a manager, and if you struggle with that, speak to your manager about it. Make sure that you've got your boundaries in place. It's for the safety of you and the people that you manage too. Some common themes that keep coming up: suicide, highest death rate for men in the northeast, between 25 and 45 is suicide. The menopause is having a big impact on organisations, anxiety and panic attacks. These are common themes that we're seeing. Intergenerational differences and an increased workload. These are all things that we're looking at. And of course, this was before the COVID pandemic, when we've got all sorts of other issues to deal with, like mental health problems, bereavement, coping with school and children, and those kind of things. And where can you signpost people to? It's important that people get the right kind of advice and help and support. And in the document that accompanies this presentation, there is a list of local talk and therapies areas, things like that. Don't forget people like Citizens Advice, Step Change if it's debt, GPs, that kind of thing, just to help people think about what support they might need and encourage them to take the advice and support that is out there. There's a lot of stuff that you can access free of charge if you know where to look. And then I really wanted to get you thinking about, how do you get your support? Where do you go? Have you got your line manager that you can talk to? If you've got a big team, it could be really, really stressful for you. Most of your day could be taken up with dealing with other people's problems. And then how do you do the work that you need to do? And think about it in advance. If you're starting to get stressed, where would you go for support? Is there a support network? Maybe get together with some other people at a similar level who have similar problems. I used to manage a charity, and the best time for me was when all of the centre managers got together and we could talk about those "is it just me" moments, or what moments that everybody faces, and we think that we can't talk about it. So make sure you build up your support network of people who understand what's happening for you. Thank you for watching the presentation. If you do have any questions, please feel free to get in touch, either with me directly or into the organisation, or visit our website www.necounselling.org.uk for more details. Thank you very much.